A new digital tool to help cancer patients accurately estimate their cost of treatment almost instantly. Developed by a team from the National University Cancer Institute and a health technology startup, it even calculates the amount of subsidies that one can get. Some 7,500 cancer patients are expected to benefit from this. Sherlyn has more.
As president of Brain Tumour Society Singapore, Melissa Lim helps numerous patients get through their toughest times by providing emotional support or financial guidance.
When I had to look after my mom with cancer, the last thing I want to worry about is to figure out the calculations. You see, I just want to get her well. The range of prices that you pay for cancer drugs can be really quite mind-boggling. For some patients, it could be $0 for out-of-pocket expenses. And for some patients, it could be well up to tens and thousands of dollars.
That's especially with changes to insurance coverage set to kick in next month. These include limiting Medisafe withdrawal and Medishield coverage to drugs on the Health Ministry's cancer drug list. And that's also what spurred the team to develop the ChemoCalc.
Because of the growing complexity of healthcare financing associated with cancer treatments and the wide availability of treatments available, we actually wanted to create a very simple tool that would actually help make financial counseling for patients a lot easier.
While it could previously take up to half an hour to do manual calculations, the new tool is able to instantly tabulate out-of-pocket costs, thanks to a special algorithm, which the team touts as being about 95% accurate right now.
The cancer drug list has many drugs and many indications. So what we've done is we've loaded all of that onto the calculator. We've also accounted for the patient's income tier so that we can guess their means testing tiers. We account for whether or not they are Singaporeans or permanent residents, and we also account for whether or not they are Pioneer or Merdeka generation, which gives them additional subsidies. And all of that calculation is done automatically.
The page will also display a list of drugs and services relevant to the patient's treatment, so claims can be submitted more easily.
There's even a mobile version that medical social workers can access on the go, for example when making rounds around the wards or on house visits. The team now hopes to expand the calculator to all public and private healthcare institutions beyond NUHS, and in the future develop a simplified version that even patients themselves can use.